Aortic valve replacement in non-elderly adults. Traditionally, diseased aortic valves have been treated with aortic valve replacement using man-made valves, which can be made either from metal, called mechanical valves, or from animal tissue, called tissue valves. If the valve needs to be replaced, traditional aortic valve replacement with man-made valves does not perform as well in younger people as it does in older patients. While traditional AVR restores survival in elderly patients, this is not the case in younger patients who have excess mortality after AVR compared to the general population. There are several reasons for this. Both mechanical and tissue valves are mounted on a stent frame that takes up space and can obstruct the flow of blood from the heart to the aorta. When the opening through the valve stent is too small for the patient, this is called patient prosthesis mismatch. More than 1/3 of patients who undergo traditional AVR have moderate or severe patient prosthesis mismatch, where the replacement valve is too small for their body. In non-elderly patients with active lifestyles, this can lead to reduced survival. Furthermore, tissue valves wear out over time and may eventually need to be replaced. Mechanical valves, on the other hand, do not wear out, but require the patient to take blood thinners for the rest of their lives in order to prevent blood clots from forming on the valve. However, blood thinners can cause bleeding, and if the level of the blood thinner is too low, blood clots can form on the valve, which can cause stroke and other serious problems throughout the body. Finally, both mechanical and tissue valves can get infected. For these reasons, we often try to first repair the aortic valve. But when that is not possible, especially in patients who are not elderly, an operation called the Ross procedure may be a better option.